Welcome to UCSI University 19th Annual Public Health Campaign 2021. This cancer information video, which is entitled Regular Screening and Healthy Living, will discuss healthy blood pressure, healthy blood glucose, healthy body weight and healthy lifestyle. Regular screening and healthy living is important in maintaining good health. The example of regular screening is blood pressure screening, blood glucose screening and body weight screening. According to the 8th Joint National Committee, the targeted health blood pressure level for elderly younger than 60 years old is systolic blood pressure not more than 140 and diastolic blood pressure not more than 90. Meanwhile, for elderly that are 60 years old and above, the targeted systolic blood pressure is not more than 150 and diastolic blood pressure will be not more than 90. For the targeted blood pressure of people with diabetes, the systolic blood pressure will be not more than 140 and diastolic blood pressure will be not more than 90. Do you know what high blood pressure is? High blood pressure is defined as persistent elevation of blood pressure in the blood vessel. This increased force flow of blood against the arterial wall damages the inner lining of the arteries. The damaged inner lining of the artery leads to building up of fat and calcium in the arteries and plaque formed. Atherosclerosis might take place eventually. So how can we maintain a healthy blood pressure? Reducing salt intake by consuming less than 5 grams of salt, which means less than 1 teaspoonful per day, is one of the ways to maintain healthy pressure. It is because the high salt level in blood reduces the ability of the kidneys to remove water from the body, and this excessive fluid causes increase in blood pressure. Examples of food containing salt which are soy sauce, tomato sauce, salad dressing and processed food. Next, reducing smoking is also one of the ways to maintain healthy pressure. As smoking can cause blood pressure to rise acutely. Regular blood tests can be done to monitor the blood glucose level. There are two types of blood glucose test, which is fasting plasma glucose test and postprandial blood glucose. Screening for diabetes mellitus should be done every year for adults. Fasting plasma glucose test measures the blood sugar levels after fasting for at least 8 hours overnight fasting, whereas postprandial blood glucose test measures the blood sugar level 2 hours after a meal. The fasting blood glucose has a target for control of less than 5.6 mmol/L, while postprandial blood glucose has a target for control of more than 11.1 mmol/L. However, the normal value ranges may vary among different laboratories. Diabetes is a condition caused by impaired insulin secretion and action. Diabetes is also classified to type 1 diabetes mellitus and type 2 diabetes mellitus. Type 1 diabetes mellitus is little or no insulin secretion in this type of diabetes and usually occurs among young children and adolescents who are less than 20 years old, whereas type 2 diabetes mellitus is where a certain amount of insulin is secreted but cannot be used due to resistance at the receptor sites and usually occurs among adults. How can we maintain a healthy glucose level? We can go for a low-sugar diet, which is to reduce the consumption of sugar-sweetened beverages and limit carbohydrates by consuming food with lower glycemic index. Glycemic index is an index that will indicate how quickly the types of carbohydrates increase blood glucose levels. Examples for low GI food are soy products, barley and grainy bread, while for medium GI food are oatmeal, brown rice and wholemeal bread. In terms of high GI food, we have potatoes, white rice and white bread. A healthy weight usually refers to having a body mass index, BMI, between 18.5 and 22.9. BMI is calculated by dividing the weight in kilogram with the square of height in meters. Excessive weight increases the risk of high blood pressure, high blood glucose and some cancers. Therefore, we should reduce intake of high-fat or high-carbohydrate food to maintain a healthy weight, as high-fat or high-carbohydrate food contains high calories, which will increase the body weight. Moreover, we can also eat healthily by reducing food portion sizes, reducing usage of fats and oil when preparing food, as well as drinking plenty of water. Lastly, we can live a healthy life by not smoking, as smoking is associated with lung, breast and several other types of cancer, as well as increases the risk of type 2 diabetes and affects medicines used to treat high blood pressure. We can live a healthy life by not consuming alcohol too, as alcohol consumption will increase blood pressure and the risk of cancer. Therefore, avoid any alcohol consumption. Besides, we should exercise regularly to live a healthy life. Exercise regularly for at least 150 minutes per week moderately. It lowers blood pressure and glucose levels, helps you keep your weight in check, and reduces the risk of cancer. We can also have a healthy diet by following the Malaysian healthy plate portions, which are known as quarter-half, as there will be quarter plate of protein, quarter plate of grain and half plate of fruits and vegetables. A healthy diet provides daily energy and nutrients. Let's live a healthy life together. Thank you for watching.